Well, let's return now to our story on the UK battling obesity. With us is Jude Oben, a consultant gastroenterologist. Good morning to you. When we say that the UK is battling with obesity and it's an epidemic, what exactly does that mean?
It means that there are 30% of the UK adult population is obese, and it's costing the NHS at least £5 billion a year. And if you add all the other costs to it in terms of bed days, it's about £15 billion a year. That is a huge amount of money. When I say to my students, do you know what £5 billion is? No, I don't. That's the amount of money that a country like Malta or the Bahamas earns every year. And that is how much we're spending on obesity every year in the UK. Simply outrageous.
What is obesity?
Okay, interesting. So actually it's very, very straightforward. You can define it by the weight divided by your height in meters squared, and if the BMI is greater than 30, you're classified as obese. But people can't even add up, let alone meters squared. You're better off with something as simple like a circ tape. That's all you need. Forget the weight, forget the BMI, you need a circ tape. And as I've said before, if you're white, move right. If you're green, you're good to go. Orange, you're in transition. Red, move left. That's it. Females, 80 centimetres. Males, 90 centimetres.
Is that just round the middle?
Round the belly button.
Right.
Yeah. So that's it. It's very, very straightforward. Our role, or rather our desire, is that every household has one of these. That's it. Very, very straightforward. Easy to define.
Yeah.
I mean,
There you go. Might I give you one?
Well, yes. I'm not going to use it on air, just in case.
Named and shamed. In terms of preventability, though,
Yes.
is all obesity preventable?
Actually, it is, right? Because if you don't eat, you're not going to get obese. Of course, there are genetic factors and there are social or health inequalities factors, but at the end of the day, if you don't eat, you're not going to get obese.
So you don't buy into this line that it's a disease, which is what
I
we've
don't
been
know.
hearing
I don't buy into it. I know that the president of the College of Physicians, of which I'm a fellow, has been saying that it's a disease, and I'm not going to argue with that. But the simple fact is, it's costing the NHS £5 billion a year. We need to do something. And if the best way to do it is to designate it a disease, so be it.
What about these clinics like we're seeing in Rotherham that no longer is getting the funding?
Yeah.
There is a big question around it. No matter how serious it is, should we be paying £300,000 for something which is effectively giving some guidance training in a gym?
Yeah. Well, if you don't do that, they will come to my clinic, age 17, with liver cirrhosis. They will come to my clinic with cancers, with prostate cancer, with breast cancer, esophageal cancer. The list goes on and on and on and on and on. And actually, it's actually quite sad. If you come to clinic at St Thomas's with me on a Wednesday morning, by the time you leave, you'll be almost in tears, because I see 18-year-olds, 175 kilos, 20-year-olds, 150 kilos, referred from all over the country. And it's sad-making. So the idea that you're going to cut the budget, £300,000 for this clinic, it's false economy, because it's going to cost you more money at the end rather than paying it up front.
So it's the cost of the secondary illnesses, really. I mean, something I didn't know is that it can cause loss of eyesight.
Absolutely, it can cause loss of... I didn't know that either. I mean, I work at a premier teaching hospital in London, but lots and lots of patients are coming to us, not just with eye disease, but also with skin disease. There's a condition called hidradenitis suppurativa, and where the skin effectively is almost rotting. And if you downsize a lot of those patients, the skin repairs itself. And again, with the eyes, the pressure in the eye increases. If you downsize them, the pressure reduces.
Just to give people an idea who may be watching concerned about their own weight, how easy is it, with the right guidance?
Yes, it's fantastically easy to downsize.
Is it?
Oh, yes, it is.
Why do so many
Come
people
to clinic.
struggle?
Oh, come to clinic. There are two ways to do it. Get referred by your GP to our clinic at St Thomas's, or see me elsewhere at London Bridge Hospital, for example. We'll tell you how to do it. It's simple. I had a letter from a patient in Hong Kong actually, as it happens, 2 days ago, he's lost 15 kilos in 4 months. That's 2 stones approximately in 4 months. It's not that difficult. It's very easy. People just need guidance. As I say, come and see me in the clinic. Very easy.
Jude.
But also what we want to do, forgive me, what we want to do is educate doctors on obesity. And what we're doing at the moment is setting up a course, healthcare learning to train doctors and other healthcare professionals on obesity. It's very easy.
Okay, you've given us all some
Positive,
hope, I think.
positive,
Jude,
yeah.
thank you very much indeed.
Pleasure.